Simon Clarke in Reading in the UK. He's an associate professor in cellular microbiology at the University of Reading. Good to have you with us, Simon. Firstly, how concerning is this outbreak of Mpox?
Well, people should be concerned about it, but not overly worried. People should understand the risk, how you catch it, and that in fact, in the developed world at least, it is very rare indeed. But it's travelling around the world. Clearly, it's already arrived in Sweden. It may have arrived in Pakistan, and therefore it could arrive anywhere else.
I understand that this latest outbreak is different to the one that we saw back in 2022, which I believe was a different strain of Mpox, one that was less fatal. So in that case, what needs to be done now in order to contain the spread? Are vaccines an option?
Well, yes, there is a vaccine that works. It really is probably our only option to put a firewall around areas of infection and try and stop its spread there. If you stop the spread from person to person of any infectious pathogen, doesn't matter what it is, then sooner or later it will die out. You can do that by stopping people mixing and transmitting the virus, or you can do it by reducing transmission by vaccination. I'll remind you that SARS, 20 odd years ago, was stopped and transmission between individuals was slowed right down, and eventually it died out.
Yes, in terms of the vaccine, we know during the 2022 outbreak, we saw the vaccine being distributed in several Western countries, including the UK. But this time around, there are reports that supplies of the vaccine are particularly scarce, especially on the continent of Africa. Is that your understanding as well? And what is the situation in terms of ramping up production of that vaccine?
Well, producing any vaccine takes time, but we know how to do this. The last time we had a shortage of vaccines, it's quite understandable because this vaccine is actually against smallpox. Now, smallpox is extinct. Nobody gets vaccinated against smallpox anymore. So why would we have had large stocks of the vaccine? And we didn't. I don't know what the current global stocks are, but you can bet anything that they'll be centered in rich countries.
Yes, and that really harks back to the COVID-19 pandemic, doesn't it? When we did see new vaccines emerge, but vaccine equity was an issue during COVID. It seems like it's also a potential problem this time round. So do you think it's incumbent upon governments and manufacturers to make sure that those who need it in Africa get it?
Oh, absolutely. And it's incumbent upon them and aid organisations to make sure that when a vaccine is shipped into somewhere like Central Africa, it can be kept properly, distributed properly and administered properly. Otherwise, there's no point in doing it. So it goes beyond simply providing vaccine doses. You've got to make sure that once they're there, they can be stored properly, that they don't go off. You don't even necessarily need particularly high heat for that to happen. It can happen at normal ambient temperatures, and that it actually gets distributed. Otherwise, there's not really much point.
Yes, and you mentioned that Mpox is related to smallpox, which, as you point out, is a disease that's been eradicated thanks through a successful vaccination campaign. Is this a concern that we are seeing a new form of smallpox emerge, or has monkeypox been around longer than what we're seeing now?
Oh, monkeypox, or Mpox, as we should call it, has been around for a long time. We just won't necessarily have identified it until sometime in the 20th century. No, this is not another smallpox.
Okay, Simon Clarke, we'll leave it there for now. Thank you so much for bringing us your thoughts with us.